Rachel Perkins. I'm the Education and Outreach Specialist for Texas Oncology Foundation. You are a part of our first week of virtual experience. We're going to have this also in the second week as well. If you're a cancer patient, a caregiver, or professional and want to educate yourself about the cancer world, we invite you to join us today and next Friday, as we have Erin Dean, who has a doctorate in physical therapy, and she's doing a workshop with us on nurturing pelvic floor and sexual health with cancer. Just a little bit of a foundation intro. The Texas Oncology Foundation is dedicated to providing support to cancer patients in the communities where they live, work, and receive treatment. Through Survive and Thrive programming, the foundation can provide educational events like this one and resources to help build the community connections and support all affected by cancer. So that's kind of what we're doing with the Canvas group there, is creating that community. So now I get to introduce Erin Dean. Erin is a doctor of physical therapy who specializes in pelvic health, lymphedema therapy, and oncology rehabilitation, and she is currently undertaking a sexual counselor certification. She has given multiple presentations on pelvic health, especially in the oncology setting, and developed the pelvic floor program at Texas Oncology. She has a background in yoga and incorporates breathing meditation and visualization into her treatments as needed. So Erin, if you want to go ahead and get us started, we would love to see your presentation today.
So I just wanted to let y'all know, so I've been working at Texas Oncology for about 5 years. So I've been working with the cancer population during that time, and I've treated lots of women, especially who've undergone breast cancer surgery and treatment with a lot of these issues. So that's kind of what inspired this presentation. Also endometrial cancer, cervical, all kinds of gynecologic cancers end up with these issues too. So that's a lot of my narrative information comes from you guys and what y'all tell me, and sort of, so it's not my personal experience, but it's the experience of hundreds of people I've talked to, just so you know. Okay, so by the way, yeah, I guess all of you are, I'm not seeing, well, some of you might have partners on with you since I can't see your faces. So this presentation is geared towards people with or who've had uteruses, but their partners can learn more about how to support them by attending. So, feel free to stick around if you're here. Also, people with other pelvic cancers may have some of these symptoms and will benefit from the information. So it's not like you have to have breast cancer or gynecologic cancers. We go into rectal cancer treatments and symptoms in the next part of this talk too. So we will talk about menopause in society to start with, and then I'm going to go through the different symptoms that come up with treatment for these cancers. So cancer menopausal symptoms, we've got pelvic pain and treatment, and then after that we'll talk about the effect on sexuality and treatment for that. Okay, and then there'll be a question and answer section. So feel free to interrupt like Rachel said, but we will have time at the end for other questions. Okay, so menopause. First off, I do want to say also, all of these resources that I give you will be, I have a page at the end with all the books and the websites that I mention, and you can take a picture of that so that you don't have to scratch them down rapidly. So just to know that. Menopause Manifesto, this book is fantastic. Would really recommend it, especially if menopause is new for you, if you're having any sort of challenges with it, especially emotionally. The beginning of the book, first few chapters are just all about the history of it. It feels really empowering to read. So definitely check that out. Some of that information is that menopause, we've got this ageist culture that implies that menopause equals doom. Yeah, which is unfortunate. And it's not really discussed in schools. We don't talk about it. So that obviously puts a negative bent on it. So historically in the US, women's worth has been determined by their ability to bear children, right? But that's no longer the case, is it? And so the thing is, menopause doesn't equal doom, all right? Someone told me recently, think about how many years of wisdom you have. 50 something, 60 something, 70 something, about your sexuality and yourself. So I know that me as a 20-something-year-old sexually versus now as a 40-something-year-old are very different, and I don't want to go back. So, and many people have the best sex of their lives after this age. And I'll talk a lot more about that in the later slides. And then, though your sex drive, sorry guys, I'm trying to be able to see this a little bit better, but it's okay. Though your sex drive might reduce, there are a lot of ways to spark it. We'll talk about that too. So I kind of like this part, other cultures' words from menopause, road from A to B. So gentle, change of year, or change or stages of life. And those are from different cultures. All right, so cancer treatments that can lead to menopause. And some of these are temporary, some are permanent. Removal of ovaries, obviously permanent. Certain chemotherapy drugs, and some are temporary, some are permanent. Radiation to the pelvis, and then estrogen blocking therapy. So a lot of my patients with breast cancer end up on an anastrozole, letrozole, tamoxifen, something like that. And these, obviously, they're leading to a rapid change into a menopausal state. So even if you're already menopausal, these can deplete the remaining the remaining estrogen in your tissues. So it can further impact your symptoms, make them worse, or reinstate them. So when menopause begins with cancer treatment, the symptoms are usually more severe because the onset is rapid. So let's talk about some of those symptoms. You might know this is a two-part series. This first part, I'm going to talk about pelvic pain, painful intercourse, and then also sexuality changes. The second part, so next Friday, same time, is going to be more on urinary urgency and frequency, and then incontinence. And we'll talk about some fecal issues too, constipation and other issues with rectal cancer, just because it's relevant to the pelvic floor. So if those are your main symptoms, then stick around or come back next week. But today is more the, I don't know, the juicy part, I think so. So why pelvic pain and painful intercourse? So this is usually what I hear patients tell me. Things happen in this order often. You go through medically induced menopause for whatever reason we stated before. And then all of a sudden, your tissues, your vaginal tissues, your vulvar tissues may become less moist and less supple. And then all of a sudden, you have sex for the first time after treatment or during treatment, and it hurts because the tissues are different and it doesn't feel the same. And so then, or you have an exam and it hurts and it never hurt before. So this can lead to guarding of your pelvic floor muscles. And that guarding leads to pain. So the guarding is also because of the discomfort, but also because there's a lot of fear around that discomfort. Does this mean that I'm ripping something? Am I damaging myself, especially after radiation? Am I doing more damage? That's a common fear I hear. And we'll talk a little more about that later. But once you have that pain, you have the fear around the pain, and then the guarding is there next time as well. And so it becomes this cycle of guarding and pelvic tension. And then the pain combined with the hormone changes can demotivate and reduce the desire for sex. So that is usually, that's I see almost I have a PA that refers to me a lot, who's a gynecologic oncologist PA. She says about 75% of her breast cancer patients have these symptoms and complaints. So it's very common. All right. So what do we do about it? A lot of things. I could talk for hours just on this, which is why people see me for weeks sometimes when they have these issues. First off, A Woman's Touch Sexuality Resource Center is fantastic. So it's sexualityresources.com, and it is just full of information and tools and lubricants and toys. It's actually a sexuality educator who started the website. So a lot of this is all there. I mean, the toys aren't free, but the education, the pamphlets are free. And I would go there if you're having any issues with this. And I send my patients there specifically for some of these moisturizing lubricants, and I'll talk more about that in a second. So what do we do if all of a sudden there's no more estrogen in your system and your vaginal vulvar tissues are different and hurting? Okay, so first off, you can talk to your gynecologist or your oncologist or a gynecologist about estradiol cream. It's basically estrogen cream that goes inside the vagina. It's a suppository, and or it goes around the outside of the vulva. So there's actually a gynecologist that works here at Texas Oncology. She works closely with actually her husband, who's a gynecologic oncologist, and she prescribes to a lot of women, even with ER positive breast cancers, because they've found through research that not a lot of this estrogen gets into the system, so little to none, and they'll keep checking your cancer markers to make sure that you're safe on it. I have had most of the gynecologic cancers not, their oncologists aren't allowing it. So that's one option to start with or to ask about. And that usually makes a big difference in people's tissues. So another one is hyaluronic acid, which sounds scary, but you produce it in your body naturally. Many of you have probably heard about Reverie, Replens. These are hyaluronic acid-based moisturizers, same kind of thing. Suppository, you put it in at night so that you're laying down, it doesn't all come out. And the two complaints I hear about this are the applicator can be challenging to put in because it's plastic and can hurt people who are having pelvic pain already. And then some people end up with some sloughing of their skin, so strange discharge occurs. But it can be really helpful, especially if you're using it appropriately. Like, I think it's 3 times a week is what they suggest. But then another option, vulvar moisturizing lubricants. And people ask me, really, lubrication? Like, using a lubricant is going to make my vaginal tissues better? But it does. So in the Women's Touch website, there's a pamphlet called Vaginal Rejuvenation. Definitely check that out. I can't talk enough about this right now because I don't have time, but in short, you get a hybrid lubricant. So that means it's water-based and silicone-based combined. The water-based lubricant moisturizes the tissues, the silicone locks it in. You put this on after your shower in the morning, all around, the external vulvar areas, around the clitoris, the vulva, if you can tolerate the very entrance of the vagina without pain. And then you also, if you work up to being able to insert some of that internally, she actually suggests using a thin vibration, like a vibrator, but there's one for sale on the website that vibrates. So the vibration, the purpose of that is when it's put internal, you actually get some blood flow, increased blood flow with the lubricant, so that moisturizes and then increases blood flow, which helps the whole system. And we'll talk more about blood flow in a minute. Also, so this little intimaterose.com, this funny little shaped purple thing over here to the left, is called a pelvic wand. And Intimate Rose has a regular, not fancy version, which is the silicone covered, I'm sorry. Yes, that's the word, silicone covered plastic thing. They have a vibrating version and a hot and cold version too. So the thinner end is about the size of a finger, and the thicker end is about the size of a thick thumb. So the thin end could actually be used for this vibration, kind of moving around the entrance of the vaginal canal with the lubricant to get that moisture. And this is if you can tolerate it, daily thing. If you do it daily, You moisturize externally and internally daily. She suggests that over a number of weeks, things start to shift and the pain greatly reduces. So that's one part of it, is your skin, right? Pain is complicated, so I can't say that that's going to be the only thing that you'll need to get better. But especially if you can tolerate putting something inside there and moving it around, my guess is you're kind of on the good end, the better end of things already. If you aren't able to get it in, one way to help yourself is diaphragmatic breathing. So it's a relaxation technique of the pelvic floor muscles to soften them, open them, so that inserting something doesn't cause pain. So I'm going to kind of go over that with you real quick. So if you can, relax back into your chair so that your stomach is soft. Okay, and if you can, and this is kind of hard to do sitting if you've never tried it. So if you can lay on the ground right now, do that. Okay, so you're relaxing your stomach. You close your eyes, hands on the low belly, and just take notice the muscles around the vagina, the anus, or around the penis if you're without a uterus person, perineum, and notice those muscles. Those are the pelvic floor muscles. So when you inhale, let your belly rise. Notice your pelvic floor drop towards your feet. Exhale, everything comes back to neutral. So naturally, when you inhale, your breathing diaphragm moves down, pushes your organs out of the way, belly rises, pelvic floor expands. As you exhale, everything comes back to neutral. So if this is, you can open your eyes, unless you want to keep trying. If this is difficult for you, if you can't breathe into your belly, if you can't feel your pelvic floor moving at all, I would practice it more. It's actually in the handout that I gave you, the details. This is a fantastic tool for a lot of reasons. One of which is pelvic pain. Another would be like constipation, difficulty urinating. So I don't know if that's you guys, but like a slow stream, trying this technique can just get the pelvic floor muscles in a neutral spot so that they're not too tense or guarding. And so say you're doing your moisturizer with your pelvic wand and it's on vibrate and you're doing it for the first time, you want to relax back in a comfortable position, try this breath, soften the pelvic floor, really get good at feeling it open and expand on inhale, and then gently insert, okay? So you don't want to increase pain. So remember, guarding equals pain. Pelvic tension equals pain. Softening the pelvic floor, you might be like, a lot of my patients, the first time they try this, it's, aha, oh my God, I can't believe I don't have pain. They thought there was something wrong with them, and it's actually not even the tissues anymore. It's just their muscles haven't relaxed in months, okay? All right, so let's move on. Just a quick little thing about radiation. So it might cause, vaginal, either brachytherapy inside the vagina or pelvic radiation can cause the vaginal canal to shorten or narrow, and it can cause the skin to be more friable or fragile. So this can then lead to difficulty with future exams or this painful intercourse like we've discussed. And so what do we do with radiation? If you get started right away after the radiation, so I would wait, you can actually, in theory, you can actually start these dilators while you're at the beginning of radiation before things start to hurt. If they do get to kind of a burn phase or a pain phase, then I would just take a break until you're 3 to 4 weeks after you're done with radiation. The tissues at that point are healed. You can start with the dilators again. So Intimate Rose, again on this left side, I love that brand, silicone dilator set, and they come, you can either get all 8 or you can get just the 4 small ones or the 4 large ones. I would If you are right after radiation, likely that you could probably tolerate the larger 4. If it's been a few years and you haven't had sex either, then you might get the whole set because you might need a smaller one to start with, possibly. Also, I've seen people with GVH. If you know what that is, if you have it, you know what that is, and they kind of follow the same protocol. So the protocol is you want to have some sort of dilator, either sex or one of these silicone dilators in the vagina for 10 minutes a few times a week, well, 2 to 3 times a week. And really, that could go on as long as you're trying to have vaginal intercourse or exams. Some people find that after a couple of years of doing this, they don't have to do it anymore. But it's the same concept. You are leaning back, you're inserting it, you're holding it in. You might have to push it in a little, so you're trying to expand the canal lengthwise and get it to tolerate, without fear of pain, some movement. So once you can push it in and hold it in, then you're going to just move it a little bit to kind of simulate that motion that occurs with intercourse, right? So that your muscles are not guarding. So patients fearing sex due to pain and fear they're hurting their tissues. If you go slow, pause, and do diaphragmatic breathing if you need to, you use lubricant and moisturize, then your tissues are going to be okay. So I think I said that in a weird way, but if you've gone through radiation, then if you do all of these things I'm suggesting, the breathing, the moisturizing, not pushing into extreme pain, then your tissues are going to be safe. Okay. I've seen it hundreds of times that the tissues are safe. All right. So now we're going to jump into the sexual stuff. So if you are comfortable, most of you, I don't think any of you have your videos on, so probably you're comfortable. Close your eyes. And if this brings anything up, feel free to leave or mute me if you don't want to kind of feel the feelings that might come up right now. But if you're open to feeling those feelings, then kind of stick around. So just close your eyes, and I just want to remind you that you went through or are going through something so hard. So it's incredibly scary. And this is the essence of fear, fearing for your life. You might feel a loss of control. Things are happening so fast and happening to you. Everything is changing. Your body, your energy levels, your view on life and priorities, your role in your family, the ability to enjoy certain things. So this is really hard. Even if you're done with treatment, the effects can last months and even years. So it's okay to take your time to get back to your old self. Or you might find yourself creating a new version of you. So sexuality is just a part of this change. It may not have seemed as essential for life during your treatment while you were in survival mode, but if you're ready, and if sexuality was important to you before, it may be a part of growing back into your vitality, your power, your sense of aliveness, your creative energy, and your survivorship. You may have been very sexual in the past, or maybe not. But with a shift in priorities may come a shift in your sexuality too. Our sexuality can change many, many times throughout our lives. And this is one change. So you get to choose how to go forward from here. Okay, you can open your eyes. All right, so this is the biggest thing I hear. My libido's gone, right? So libido's fragile. It decreases with stress, sickness, menopause, children, distraction. And feeling desire for sex is similar to feeling playful and curious. So if you're super tired, exhausted, fatigued, it's less likely you're going to feel this desire for sex, right? And also, like I said just a second ago, libido changes throughout our lives, and that's normal. But we might be able to spark it if we want to. So we're going to talk more about this in the following slides. And I have a lot of people ask me, is it true that if you lose it, or sorry, that you'll lose it if you don't use it, right? And that's a yes and a no. So if you have more arousal and more orgasms, solo or not, you get that increased blood flow that you also get with the vibration. And then this leads to more supple vulvar skin, therefore more pain with sex, or sorry, less pain with sex, or less pain with intercourse, we'll say. And then you're more likely to have spontaneous arousal. If you have more blood flow, your tissues are more engorged more of the time, you're more likely to feel more spontaneous arousal. We'll talk more about the different kinds of arousal in a minute. So also, this can help more arousal, more orgasms can help with erectile difficulties, as well as proper pelvic floor exercises. FYI. So let's talk about treatment for libido issues. So obviously thinking about sex. Stress and fatigue are prevalent, and that's going to impact your sexuality. So you grieving your cancer and reconnecting with your body is super important. Step one. And then body image reset. And I'll go, each of these is its own slide. Partner or partners communication. I just put that in parentheses because some people have more than one partner. From here on out, I'll refer to it as partner, but other course, good enough sex, it's a model that we'll discuss, and then sensate focus. That's where we'll end, and hopefully I can finish all these in 10 minutes. It's a lot. Okay, so the effects of cancer treatment can sometimes linger for years after it's over. So that's why I say energy and stress management is important during and after treatment. So use your energy to do things you like to do. We think of spoons, having maybe 10 spoons back in the day when you were pre-cancer, you had 10 spoons per day. And you would use some on exercise and some on doing the dishes, and then you'd work, and then you'd have some kids or something, or grandkids around, and then, I mean, who knows, maybe you had sex in the evening or something like that. Now, if you're going through cancer, you could have 5 spoons, you could have 2 spoons, 3 spoons. And so what are you going to use those spoons for? If you're only doing things that don't energize you emotionally, you're going to deplete yourself. And then life doesn't feel as fulfilling. So remember to use your energy for the things that you like to do. And then, like I wrote down here, ask for help. You have to ask for help. And this, again, not just during treatment, but this can linger for years. If any partners are out there, it's normal for this to linger months to a year, sometimes longer. There's ways that we can make it improve, and I'll talk about that too. But ask for help, ask for what you need with your family, your friends, your work. And then movement and exercise, incredibly helpful. So there are a lot of studies out there talking about fatigue and consistent, there's metrics for this, but consistent cardiovascular and gentle weight training activities weekly, can slowly but surely over a few months improve fatigue. So it's a slow process, but movement and exercise actually improves your fatigue. It doesn't improve it if you do a whole lot and then you fall, you drop, because you are doing what you used to do and it's way too hard now. Know that it's going to be different for most people. And then stop to check in with your body throughout the day. So I was on a training in Denver a while back, earlier this year, and it had been a really, really hard few months previously to that. And I had also lost touch with my body and what I needed. And someone said, notice pleasure. Okay, so notice pleasure throughout the day. And all of a sudden I was walking and I saw there was the sun shining through these really cool, tall, frondy, bushes. And I stopped because I would just have continued on, but I stopped and I saw that sunshine coming through those white, like a halo on all these bushes. And then I noticed the breeze on my face, and I just took 30 seconds to stop and notice pleasure and how it feels in my body. Okay, so that can be almost step one. So not just that, but take time, maybe even set an alarm for a few times a day to just check in with your body. I have a lot of patients, some who will just run through their day like they used to, and then by 7 o'clock they fall asleep because they're exhausted. So if you stop, check in, how do I feel? Am I tense in my core? Am I not breathing? If I just stop for a second, am I exhausted? Like, check in with your body and do what you need to do, and then ask for help. And then making time for intimacy with your partner during cancer treatment may not mean sexual intimacy. It could, but touch, cuddle. If you have boundaries around that sexual intimacy, it's not something that's on the table for you. Let your partner know that. Like, this is my boundary. I just can't do it, but I don't want to lose that intimacy with you. Tell them that so that you don't feel like if you do one thing, it's going to lead to them wanting more, so that you can maintain that connection with them. So first, grieve and then reconnect to your body. So during treatment, it's common to feel like things are happening to you and to your body, as well as a lack of control. So many people check out and disconnect. So cancer treatment can be traumatizing. So how do we reconnect? We first grieve. So allow for these feelings that come up when you think about your cancer to be there. If you feel mad, if you feel sad, if you feel scared, just allow them to be. Take time to feel these feelings, these emotions, so that they can work through you, right? And definitely seek out mental therapy, mental health therapy. Super helpful to help you grieve through this process. There's a lot of support groups as well. I know a lot through Texas Oncology Foundation too. So then, like I said a second ago, notice pleasure. And then also your body's response to stimulation might change now, especially if you're still in that disconnected place. If someone touches you, it could feel threatening, it could feel painful. So grieving, reconnecting, and noticing what you feel on your own self. So there's a fantastic exercise that if I were you, I would start here. All of you start here. It's the website right there below, bettymartin.org/hands. It's called Waking Up Your Hands. So it's an activity where you learn to access a state of relaxed pleasure. So what you're doing is touching an object, and you're exploring the sensations, you're feeling pleasure, and then noticing the feelings that come up around that. So it takes practice. I think she suggests doing it 5 minutes a day for a number of days. And this is the baseline for being able to reignite libido, desire, and arousal. So on that website, if you go to that spot, the first video is a how-to. She'll talk you through it. And then the second one is kind of what's going on in your body and your physiology when you do this exercise. So very, very amazing. I would check that out. And then a body image reset. So research shows people with poor body image have lower sexual desire, which isn't surprising, right? So see if you can touch your new body with interest. Notice and grieve what comes up when you touch your new body, whether it's, you might have gained weight or lost weight, or you might have different breasts, or you might have a different anus or a different vulva, or your vagina might have an end, right? You may have lost your hair. So just touching that new body with interest and noticing what comes up and allow that to flow through you, those feelings, grieve them. And then try to love your body as if it were your child. You might even try saying like something that you would say to a sweet 3-year-old, like, oh, I love you so much. And I know this is hard, but that can actually really help. I have a lot of patients who are very resistant to touching their own body, especially with new breasts or different breasts. And I have them do that as part of our therapy because of if I'm teaching the manual lymph drainage, and at first people are very resistant, kind of icked out. But honestly, as you get more used to it, it becomes more normal. So Emily Nagoski, she's an author of Come As You Are, which is also a fantastic book. And I was listening to this talk she gave. She said, change how you see, not how you look. So she actually suggested looking in the mirror and saying, if you go by she, that she is so beautiful, and meaning it. You'd be surprised what comes up. Meaning it. She is so beautiful. Okay. And then your partner's work is to learn to love the new normal. So this is essential. You focus on what you love about your partner's new body, how it feels, how it looks, how it moves, and express this to them. It's very important. I'm sure if there are any partners in here, I'm sure you've done this, but part of this work for the patient is the same work for the partner to learn to love that new body. And then other suggestions, look at media with people with bodies like yours who are thriving and loving themselves. Instagram, stop following like the teeny, I don't know, don't follow the things that make you feel bad. Watch shows about people with bodies that are similar to yours that make you feel good. Just, you don't need to, there's so much stimulation out there with social media and the internet, and just, don't follow those things that make you feel bad, right? So partner communication. So earlier we were talking about how blood flow can increase a spontaneous desire, which means that out of the blue, you might have a desire to have sex, right? And that for a lot of people after cancer, they don't have that anymore. And that is upsetting because they used to, but you may have responsive desire now, which is for some people the norm throughout their life. So know that if you're not having spontaneous arousal, even if you used to, it doesn't mean that you're not normal, okay? So it's really common after all of these estrogen depleting treatments to not be the one to initiate sex, okay? But you may, so tell your partner that they need to initiate more likely, and then be open to slowly allowing yourself to feel aroused. So you may need more physical stimulation now than you did before to become aroused, or to orgasm if that's something that you could do before. It might take more now to get there, and that is also normal, okay? So acknowledge your fear, yours and your partner's. So your partner may need to know what you're thinking and how to touch you again. I have a lot of partners who are scared, and that makes sense because they don't want to hurt you. They don't want to be that person, but you can guide them through by doing exploration on yourself first, what works for you and what doesn't hurt you. And then there's a study on optimal sexuality. So it's called From Closet to Reality, Optimal Sexuality Amongst the Elderly. And it's a study of over 60 people. A study of people over 60 in relationships together for 25 or more years who self-report optimal sexuality. So it's interviews with a bunch of these people, and they put it all together, the data together, and it suggests that optimal sex evolves over time, flourishing when the relationship deepens with maturity and personal growth. So this is a huge challenge that you've just undertaken, and it's possible that your sex life can actually flourish because of the new communication you have to have, the changes that you've undergone, the switch in your mental space, and the personal growth that it requires. Okay, so your sex might be better than it was. Just putting that out there. So optimal sex is not goal-oriented, but rather focused on pleasure and exploration with humor. So in a nutshell, communication is essential, and saying how you're feeling, your deep desires and your challenges, and your partner doing the same will get you there. 2 more slides and 0 time. Rachel, can I keep going? 2 more slides.
Yes, go ahead and finish it out.
Okay. This is like the good stuff right here. So
Yeah.
other course is something sexualityresources.com. They have another pamphlet on other course. It's really helpful, especially if you're having pain with sex, and if you're interested in having if you're having pain with intercourse and you're interested in having sex again, this could be a really helpful tool. So what is sex, by the way? Penis and vagina. What about people who don't follow these gender roles? What about people with different anatomy? What about people with difficulties maintaining erections? What about people with changes in their vaginal tissue or other pain in their bodies? So other course is a term describing all other sexual acts beyond that, penis and vagina. And there's a downloadable pamphlet there on this website. So it's kissing anywhere on the body. It's touching anywhere on the body. It's exploring sensations, intimacy, playing together, again, without goals. So sometimes the best sex has no penetration and no orgasm. Blew my mind when someone said that to me for the first time. I'm sorry, there are 2 more slides. I lied. Good enough sex model. So this is a similar concept. The idea is to share desire and satisfaction rather than individual sexual performance, rather than on romantic love and passionate sex. So it's, let's see, I think I'm going to skip part of this. Yes. Yeah, I'm going to skip that. So sensate focus. This is one version of how to do good enough sex. Is sensate focus, Cornell Health sensate focus there on the left. If you Google that, then you can find the PDF version of this that I really like. There's a lot out there. This was a concept developed in the 70s. So the idea is it's a focus on sensuality and sensations. So it's a way to rediscover each other's bodies without goals or expectations. So you do this when partners are in a relaxed, rested place and feeling kind towards each other. Very important. 4 steps. And you move to the next step by deciding together to do so. If you are in pain and worried about intercourse, then I would just tell your partner the first week, the first 2 weeks, all you're going to do is step 1. And then y'all can decide together to move forwards. But just, if there's pressure to move forwards, if you're not ready, it's going to take away from the whole thing. So step 1 is non-genital touching. So one person's leaning back in the other person's arms. One person is touching the other person's body all over, except for the genitals or the breasts. And that person who's touching is noticing what it feels like to touch the other in those places. What, the temperature, the pressure, the feeling of the skin on their fingers. And then the person who's experiencing it is just noticing the same thing, what it's like to be touched in those places. Does it tickle? Does it hurt? Does it feel cold or hot? And then step 2 includes genital or breast touching. And this again is taking turns. You're exploring the body and its sensations without goals. So without the intention of causing orgasm. So there is no just staying in one place in order to cause orgasm. That's not the point of this exercise. And then mutual touching. So you're continuing with sensuality without goals and without kissing or intercourse, but you can add your mouth. Mutual touching is crazy because all of a sudden you're really in your brain about the touching part and the sensations, but you're also getting touched at the same time. Once you go down this road, you just realize how complex and interesting just this alone is, right? We don't have to have the goal of orgasm or even penetration. But if you want to go there, step 4 is sexual intercourse. By the way, erections aren't the goal, but if they occur, that is totally fine. It doesn't mean anything has to happen because of it. Doesn't mean that the erection must lead to an orgasm. All right. And that is actually the end. So that's my kind of, here's one tidbit of how to get back into your sexual self. But I would definitely do the waking up the hands first before you try this. So that's my resource list. Take a picture, and then I'll put up my information at the end, but I'll give you a few, another minute on here. And this is question and answer.
Yeah. Thank you so much, Erin. That I took a bunch of notes. So this is very informational. And I will make sure all these resources are also available to you guys on Canvas, as well as they will be in the email that you'll get later today with all the information that we've given you the past week. So, Erin, we do have some questions. So
Cool.
let me go ahead and start. The first one I want to start with, because it was something that we recently hit on, is your topic on body image reset. I had a participant ask, would this also work for your partner to do with you? And could you walk us through maybe an exercise that this would be for a partner activity?
Okay. So really, the sensate focus could be used as kind of a canvas for this.
Okay.
I would maybe try first just looking in the mirror and taking off your clothes and looking at yourself. And like I said, saying, you are so beautiful, and feeling it and meaning it. And it could be helpful to have your partner there and telling you the same thing. And it might feel different for them to say it versus you to say it. So that might be step one. And then when you're doing sensate focus, that first part where you're just feeling each other's bodies, if what comes up is hatred towards your body or any negative emotion, take note of that. And you might just kind of, if you need to pause, that's okay. And see if you can bring your partner to tell you, you are so beautiful, or you tell yourself in that moment, you are so beautiful, and mean it while you're being touched in those places. Again, we're not starting with breasts or genitals though. So once you get to the breast, if that's your spot, that's challenging, that's what they could focus on, and you could focus your energy at that moment.
So the body image reset is typically done for yourself in the mirror, and just like being genuine and authentic to yourself, telling yourself you're beautiful. And then if you want to move into the partner, that would be the more of the sensate focus.
Right. Yeah. It's just kind of, all of it is really slow, but knowing that really the key is that it's common for people to not like their new bodies or feel like it's not them. It's not their body. It's like this reminder of their cancer. So it's really, I would even, so looking in the mirror and saying those things to yourself, but even then laying on your bed and feeling, kind of doing a little sensate focus to yourself, feeling those new parts and noticing what's coming up, grieving it, remembering now, this is me, this is me, this is me.
Mm-hmm.
I am beautiful, right?
Yeah. Okay, so let's move on to another question we had. You mentioned vibration helps with blood flow, and I think the question is more of like, does blood flow help with reducing pain and inflammation, or how does that work?
Okay, so you probably have heard the term vaginal atrophy, which is kind of an old term for what happens with menopause, but the vulvar tissues and the vaginal tissues become generally thinner and a little bit more brittle, which just means there's less natural lubrication and they're not as plump as they used to be. So then it can make friction harder to handle, right? So with blood flow, you get more, you can imagine it's like more liquid is going down there and allowing for the tissues to become a little more plump as they used to be. So it only decreases the pain in that way, is that the tissue, it's like one of the ways to decrease that thinner skin. Yeah.
I know we're going to go into this a little bit more on our next segment. So this will be our last question before we close it out. But we did have a question about what about urine leaking when sneezing, or if you just can't hold it?
Yes, I will go into a lot of details on that next time. And those are two separate questions, actually.
Okay.
So that's kind of like all of what I'm going to talk about next time. So you just got to come back or listen to, if you can't show up that day, you know, it's going to be recorded, so you can look at it later.
Okay, cool.
Yeah.
Yeah, I thought that would be a good segue into just saying thank you so much for coming, and that we will see you guys next week as well. If you have any last minute questions, let us know. You can always email me. We also have a discussion board on Canvas that you're able to put these questions into, and I make sure that Erin has access to that so that she can answer some of these questions a lot better than I can. So I appreciate all you guys coming today. I'm going to go ahead and close it out now, Erin, unless you have anything else that you'd like to say. No.
I appreciate
Okay.
you showing up.
Okay. Let me go ahead and close it out for everyone. Just a reminder, the session was recorded and will be sent to all the registrants who signed up for this in our follow-up email today. You'll get a Friday email with all the links to the recordings, all the resources that we gave you guys this week. It'll also be on Canvas as well. Don't forget to head over to our discussion post that I just mentioned. It opened up on Monday, so we already have a couple questions in there from the past week of workshops that we've done. Go check it out. Go see if you can maybe add on to that, comment on them. Even if you don't have a question of your own, it's a good space to create community and meet people who are going through a similar situation as you. So our upcoming workshops for week 2, we've closed out this week. You get the weekend off, but on Monday we have a cooking demo. It's dinner with Leah. It's at 6 o'clock, and we will be doing, we'll be posting the recipe today so that you guys can get groceries. I know we talked about that this past Monday, how to go grocery shopping on a budget, and this is actually directly from that. So if you plan on going grocery shopping this weekend, you can definitely check out the recipe we'll be doing on Monday and join us for our cooking demo on Monday. Tuesday morning, we have Qigong, which is really good to start movement. We just learned that exercise is great for sexual health, so we can do some morning Qigong on Tuesday. Wednesday, we have our inner strength meditation with Dr. Zuniga, who is very calming and is very good at helping you learn about your new body, and also learn how meditation doesn't have to be perfect. So even if you're like, I'm not good at meditation, this is a good option for you. Thursday morning, we have yoga, again, another movement session. And then Friday, we will be back here with Erin Dean for part 2 of nurturing pelvic floor and sexual health with cancer. And we'll be able to answer in depth more about that last question we had about if you're unable to hold it when you're sneezing, or you just can't hold it at all. So
Can I say one thing real quick, Rachel?
yes,
The way Qigong, not Tai Chi.
Qigong, yeah.
Okay, never mind. Well,
Yep.
I was going to say Tai Chi, yoga, anything balance when you're strengthening the ankles. Balance is one of the best things you can do for your pelvic floor.
Yeah.
For the strengthening purposes. So, yeah.
Yeah, she focuses a lot on that core. So I know we had a couple of you guys at Qigong this past week, so we'll see you again next week. So thank you guys so much. I don't know if you can see the chat, Erin, but it is lighting up with thank you. Thank you for sharing with us and helping and being encouraging. Thank you for this topic and the great info. And thanks everyone for coming. We'll see you guys on Monday.